By its nature, military medicine was impersonal. The doctor-patient relationship seldom had time to form. The basic concern was health, not sickness. In this quote, we can see a perfect summary of what military medicine meant. It needed to do the most for the command, not the individual, a concept hard to fully understand considering what medicine is always conventionally represented. Good morning, I'm Chiara Strazioso, and today the book I'm going to talk about is called Fighting for Life, American Military Medicine in World War II. This book is written by Albert E. Cowdrey, a renowned non-physician war historian, chair of a department of conventional war history. The plotline develops in two different branches. It reports firstly the major campaigns of the war with the addiction of historical details of each. And at the same time, it describes these events from the critical perspective of the effects of diseases and combat casualties, providing also a great amount of medical descriptions. In fact, as we can see with the explanation of all the vitamin deficiencies in Chapter 2, the book can be addressed also to a non-medical audience, which would be able to fully understand the content without missing any important point of the narration. It skillfully combines authoritative documentation of the development and progress of medical care on all fronts and among the three services, the Army, the Navy, and the Air Force, addressing also the problems related, such as lack of recruitment or not having precise roles in the medical field. In fact, a pharmacist could perform an appendix removal without any medical knowledge. Cowdrey elegantly describes the revolution in military medicine during the war. With cinematographic descriptions, he tells the consequences of the malaria epidemic, which were very important for the actual strength of the soldiers, since it gave fever and sometimes also chills. At first, consistently with the first quote I presented, only the symptoms were controlled with a new drug called quinine. But then some soldiers were provided, as a form of preventive medicine, with a new bitter pill called atebrin. I think this is the most interesting part to analyze, since we can do a comparison with the present medicine. Because since the pill could cause nausea, fever, and sometimes also psychosis, some soldiers failed to take the pill, so vanishing the effect. Here we can see a clear similarity with the present situation of COVID-19 vaccine, with people that are too scared of the consequences to take the vaccine itself. The new means of air and land evacuation also implemented and emerged eventually into the most successful system of medicine ever developed. At first, with air evacuation to move the sick and wounded on Guadalcanal, to finish then with the LSTs, tank landing ships, in 1945. The invasion of Normandy and the final drives to end the war in Europe are described with details in triage and progressive steps of surgical care, from debridement and open wound techniques to definitive surgery, so the agonizing pain of amputation and plastic reconstruction. Another important point he addresses is the problem of the psychiatric state of the soldiers, who during war could experience breakdowns and psychotic episodes, and after the battles presented symptoms of the so-called shell shock, also known nowadays as PTSD, so post-traumatic stress disorder. So, in conclusion, through the use of simple language and true quotes, which is something I really appreciated, citing also renowned medical and military components of history, for instance Florence Nightingale, I think Cowdrey created a piece unique in its kind, which I believe could be an interesting reading both for enthusiasts and not.